I am Dr. Rezaul Karim. I am Professor of Radiology in the Department of Radiology in College of Medicine and Sagore Dutta Hospital in Kolkata. In our country, this thing has been in the debate for quite a long time. We radiologists feel, who are working in the government hospitals or in medical colleges, that radiology should come in the undergraduate level, because you find any doctor anywhere in the country or abroad, when seeing a patient, he will always prescribe some radiological investigations. But unfortunately, they are not being treated not being taught radiology in the undergraduate level. Whatever radiology teaching they get, actually they get from non-radiologist. Like the medicine people go with some cases, show some X-rays and CT scan on others, and they point out some findings there. But as for the last 15 years I am associated with the teaching of radiology, I have always felt the need that it should be done by the radiologist only, because many of the findings they miss, sometimes they misinterpret also. There are many things. Suppose in a simple X-ray also, many of the findings it is not possible for non-radiologists to understand, but unfortunately they are being treated, they are being taught by the non-radiologist, and that creates a lot of misunderstanding between the doctors who are treating the patients and doctors who are writing the reports. From the Indian Radiology Imaging Association, we have actually put forward a proposal to the Medical Council of India and to the Government of India to introduce radiology in the undergraduate level. But unfortunately, for the last 2-3 years, sincere efforts, MCI has already cleared the proposal, but it is pending with the Government of India. Unless and until Government of India agrees, no course can be initiated in any medical colleges of this country. But we are hopeful that in near future, maybe in 2 to 3 years, because government has assured us that will be very soon started, and if that is implemented, there will be a tremendous, I tell you, revolution, because radiologists are at a loss to explain sometimes to the non-radiologist, because they don't have any exposure. So that is one thing I think should be taken care of by the government, by the medical fraternity and the radiologists themselves. We have mooted the proposal. Okay, the proposal was passed in our Radiology Association. We forwarded it to the Medical Council of India, and Medical Council of India has actually taken cognizance of the case, and they had a lot of deliberations, and ultimately they forwarded the proposal with their positive comments to the Government of India. But till now there is no notification, so it has not started now. As a radiologist, what we do, we try to give a very objective observation about the anatomical or pathological findings that is there inside the body. So sometimes it happens that it doesn't corroborate with the clinical findings, and those are the areas where radiologists are unfairly victimized or unfairly criticized, and sometimes even I know a few examples, and doctor had to move to the court also because there was some misunderstanding between the findings. Okay, the findings didn't corroborate. So in those cases, you see, this problem will always be there unless and until you have proper exposure of these people in the field of radiology. As I was saying, that in undergraduate level you don't have that exposure. In the postgraduate level also, at least in West Bengal, I find that radiologists are not being involved in the rendering teaching of radiology to such surgeons or to medicine people. So this is one area has to be addressed. I think everywhere, wherever there is some amount of teaching of radiology, that should be taken care of by the faculties of radiology only, and not by the non-radiologists. It is creating a lot of problem. This is one facet. Second facet, I think you can bridge the gap by having a multidisciplinary seminar. Okay, you present the case, discuss among yourselves. The medicine people should be there, surgery and all other faculties should be there, and they should reach a consensus decision after seeing the objective findings of the radiologist and the clinical observations that is made by the clinicians based on the history and other clinical findings of the patient. That is one area, and very, very urgently it should be addressed, because in our country many cases remain undiagnosed, okay, for no fault of ours. Everybody is equally committed, but even then there are many cases which we cannot diagnose properly. So I think this is one area should be addressed. This has been a thorn in the throat of radiologist. Wherever a doctor performs obstetric ultrasound, he has to give a declaration. That declaration has actually three parts, A, B and C. And many of the information that is being sought in that report is basically none of the business of radiologist. The radiologist is visualizing the fetus and giving his observation about whatever findings is there. Okay, it may be some congenital problem, maybe the approximate gestational age, the weight and position of the placenta, the amount of liquor, all these findings we always give. Okay, now they are telling about the sex ratio. That dwindling sex ratio is because radiologists are diagnosing male and female and they are giving a signal or something like that. There are a lot of debate about that. But the problem is there are cases in Maharashtra, in Rajasthan, in Bihar, where doctors have even been arrested because he has not filled in the form properly. And if you see the questions, those questions are very ridiculous questions. As a doctor, what do? We treat patients. We are not there to kill anybody, neither the male fetus or the female fetus. But we are unfairly victimized, not because of our fault. There might be some people who are performing those things. That is the purview of the law enforcing agency, the police and others, to arrest and give proper punishment to them. But most of the radiologists do not perform. 99.99% radiologists do not perform sex determination. Why they should be unfairly victimized? There is from our side, we are always ready to give a declaration that I have not examined the sex of the fetus and take a declaration from the patient that she has not asked for. But other information, there are I think 11 or 12 points that has to be answered by the patient, and I have to note those. But that is none of my headache. I don't perform abortion. The abortion is performed by the gynecologist. So PCPNDT Act, Supreme Court rightly pointed out that there is some problem, okay, and it was on the basis of their recommendation that PCPNDT Act has been enacted. But this Act has many loopholes, and our association has also approached the government to seal those, to rectify those anomalies. If I give you one example, you see in Rajasthan, the sex ratio is very, very adversely skewed towards the males. Okay, 1,000 males into 869 female. So this is a tremendously bad situation. But that bad situation is there since the last 50 years, not that it has occurred today. And radiological investigation, determination of sex is only 30 years, since the last 30 years it is being performed. Okay, so how can sex ratio be affected by them? And what happens if the a baby is born, a female baby is born and is being killed? Radiology is not responsible for that. If you cannot create congenial atmosphere for the women's safety and women's upbringing, then this problem will always be there. This is basically, if anybody is basically responsible, it is the politician of our country who are responsible, who have made the life of the woman very, very miserable. Even if we had a prime minister who was a lady prime minister, I am sorry to say that woman has no safety and no guarantee that she will survive through whatever a male person is expected to live, 70 years or so. So this is one scenario. Another scenario is, if you increase the female literacy, you know, most of the requests for sex determination come from the women themselves. So you have to make the women totally literate. If in Kerala this problem is not there, they have 1024 female per 1000 male, because they have 10% literacy. So this enactment is not going to decrease this problem. If you want to stop the menace, you have to increase the female literacy and empower the female. That is the most crucial thing. As a radiologist, I also always feel that.